So, welcome to Jane Robinson, who is with me today from Sheffield. In fact, Sheffield Children's Hospital, where I believe you're the chief paediatric physiotherapist. Is that right, Jane? Do you want to tell me a
Yeah,
bit more about your role?
yes. So I'm I've got an impressive title, principal physiotherapist, and I co-team lead a group of physios and OTs who work for the paediatric pain management service, and some of the occupational therapists also work with the chronic fatigue service here.
That's right. So you're involved with chronic fatigue and pain management, which are two things which I know that a
Yeah.
lot of our, viewers, both parents and teachers, are really keen to understand a little bit more about, because it's something that was never really a thing when we were growing up, and now it's such a thing. We all know somebody with either chronic fatigue as a child, or chronic pain, and inexplicable pain at that. So, and I know that you
Yeah.
and many of your colleagues have come to yoga, because you feel that yoga might have something more to offer in this field. So I think maybe our interview will be around, or our conversation will be around that. It'll be around how yoga fits with physiotherapy, and specifically a disorder that's come to light recently, which I think we know is acronym as FND, so functional neurological disorder. So we're going to talk about that a little bit as well, which I know as soon as you guys listening or watching hear about this, you'll be very interested, because I was absolutely fascinated. So let's start then with, why do you think there's such an interest among physiotherapists to do yoga training, like become a bit more educated about yoga, especially for young people? Why is there an interest in that now, do you think? What's that come from? Oh, not, am I freezing a bit, Jane? Did you hear me? Can you hear me okay?
Sorry, I didn't hear all of it. I can hear you now. Yeah,
Oh,
sorry,
sorry about
at
that.
my end.
No, it's probably my end because it's quite windy here today. So yeah, so just, but the yoga for physiotherapists. Why do you think physios are interested in yoga?
So I guess so physios are interested anyway in getting people moving and active. And I guess traditionally the way I was trained in terms of assessment, where you kind of home in on a particular joint or area of the body, and you might look at the joint above and below, and you kind of then incorporate the core, but actually it felt kind of isolated to me in terms of the rehab that we offer, and I'm sure that there will be other people who already take a more holistic approach. But the thing that attracted me about yoga was the fact that if we were doing some sort of rehabilitation or exercise, that did take the whole body into account, and that you weren't just homing in on one particular area. So if, for example, someone had knee pain on the right, you would be looking at things on the right hand side and the left hand side and doing those exercises on both sides. So you get, I think, a balance in yoga asanas, in the poses and the flows, that brings a lovely balance to what you are offering
Mm.
in terms of physical rehab. So it's not just isolated to that particular muscle group or that joint, or so it just, for me, began to feel much more holistic in terms of looking at the whole body and what was going on in the whole body, rather than just homing into one particular joint.
Yeah, and recognizing that the body's all connected. We have
Yeah.
muscle trains that connect each other. Yeah, of course, I completely see that, and that makes a lot of sense. And I think for many of us who've had that experience of yoga, we can all be testimony to that. That feels
Yeah.
good. And so, bringing us on to pain management. So that's something that's obviously of great interest to you. How
Yeah.
do you feel that yoga might support young people who have chronic pain then?
So I guess the reason that people develop from an acute pain problem, so one that is very almost clearly bound up with a particular event or trauma. What happens is that normally, if you have an acute injury or some surgery or something, the pain that you get from that, for one thing, you expect and therefore can often tolerate, but you also have the possibility and the expectation that it's going to get better as the injury recovers. And but we have this group of well, children, young people, but adults also, who go on to develop persistent pain problems. So the pain persists beyond 3 months traditionally, which is the sort of healing time of most tissues, and hangs around, and therefore becomes a problem because it interferes with normal activity, stops you doing things. Because if something hurts, you avoid doing it, you shy away from doing it. So I guess that there's a number of reasons that can happen. One is that nerves in the body that would normally send normal signals like touch and movement become oversensitized, and start to send messages that the brain picks up as damage and therefore become painful. And another is that lots of things, so there's the model, the biopsychosocial model, which we talk about, which looks at the fact that things outside of the body influence how we feel. So if we're stressed or anxious or sad or worried, our brains and bodies are sort of set up so that we will recognize more danger. And if that comes in the form of pain, then we will get a bigger pain response. So we know that young people, children, young people are in this new society where there are even more stresses on them than even we had when we went to school. It's sort of 24-hour availability, social media, all things that come with being connected to devices, the problems within the education system, which mean that you have this very sort of top-down pressure cooker approach, and a big sort of underlying importance of numbers in exams rather than what you yourself can do. So with all of that added stress, we're just seeing more and more children and young people whose pain becomes more persistent. And I guess the approach that then yoga has to offer is the mind-body connection. So yoga is mindful moving. You're paying attention to what you're doing. And I guess as a physio, what makes that particularly attractive again is that it is possible to sit and practice mindfulness, so mindfulness of sound and mindfulness of thoughts and body scans and things like that. But actually what you're doing in yoga is adding another dimension onto that.
Mm.
So in terms of paying attention to what your body is doing, you've got the fact that if you're, for example, standing on one leg, you have to pay attention to that, otherwise you fall over. But also that you then start to actually physically move the parasympathetic and the sympathetic nervous system, that autonomic nervous system that is so key in stress. So you have this way in through that and through breath practice to begin to actually physiologically affect what's going on to those other bits around the outside of pain that sort of come on and stick on and make the problem so much bigger. So I think for
Right.
me, it starts to sort of, it really makes sense of treating someone within that sort of biopsychosocial model.
That makes so much sense. And using those sort of terminology brings it into focus what we're actually doing as opposed to using yoga terminology. So when we say biopsychosocial, we sort of understand it in that context, which I think is really helpful. And that brings me on to something which you introduced me to and which I've heard too many times since as an issue, which is something called functional neurological disorder. Now, tell me a little bit about that, Jane. What does that actually entail? What does it look like in your clients that you see?
So, there is an argument to say that pain and fatigue are functional symptoms as well, in that they're not tied down and limited to one particular part of the body or one particular thing that's gone wrong. But I guess what we're talking about more generally with functional neurological disorder can be sort of split broadly into two categories. So things like functional motor disorders, where the way a body moves is interrupted in some way. So that can present with things that look a bit like a neurological disorder. So it can appear to be that a paralysis. It can look
Wow.
a stroke.
Wow.
It can, look like a joint is locked into a position. And it's described as being a software problem, if you think of the brain a bit like a computer, rather than a hardware problem. So people, will undergo lots of testing for neurological problems. And the good news always is that there's no damage to their nerves, there's no damage to the nervous system per se, but the way that the nervous system is coping with stress and in some cases trauma is that it's blocking movement essentially.
Yeah.
So that and normally a lot of movement is automatic,
Mm.
so we don't think about it. So if you then start thinking about how you walk, what starts to happen is that the brain starts to try and take control over that. So walking, for example, becomes very hard and laborious because you're trying to pay too much attention to it. Um, so
Wow.
functional neurological disorder can present in that way in terms of motor disorders. And then I guess the other big area is functional seizures, so non-epileptic seizures. So
Yes.
the fact that someone will look to the outside, to family and friends and school, like they're having an epileptic seizure, but actually when the sort of tests are done, when EEGs are done and scans are done, there isn't an area of over electrical activity in the brain. So again, it's like the brain has sort of disconnected and isn't suppressing that thing. It's almost shutting off and it isn't allowing the sort of normal things that should happen to happen.
Goodness me, I mean, that must be quite frightening, both for the children and the families, you know. And I think what's also really interesting about this, you know, from a sociological perspective, what you've told me and what other people have told me actually, is that it often happens, well, not often, it can happen in a group.
Mm.
You've mentioned this, that this is, so tell me a little bit about that before we start unpicking the yoga connection there.
So I guess we if we're talking about it happening in a group, it would depend on what that situation is. Um,
Mm.
so if if someone is in a group situation, is starting to feel overwhelmed and stressed, I guess one of the ways for their brain to deal with that is to do this kind of shut off,
Right. Yeah.
and to dissociate um, from what's happening.
Mm.
And that can be when you start to get things like that. I guess the other thing about it happening in groups is that we all have, as you know, these areas of mirror neurons in our brains, um, which help us with empathy and tuning into people. So it's unfortunately possible that in some groups it can feel like, or groups of friends, it can feel like it's catching because they've started to pick up on then their mirror neurons have subconsciously started to pick up on what's going on on the stress and the cues that they're seeing in the rest of their group of friends.
And it becomes a coping mechanism. It becomes a sort of adopted coping mechanism towards overload of stress. Is that what you're saying?
Absolutely, and I think the really important thing to say is that it's not a conscious coping
No,
mechanism.
absolutely. Yes.
It's just the way the brain is finding a way out of that,
Mm.
again, that problem, out of that danger, and it's functional because it works. So and you're taken out of that situation. Can start to do is
I'm going to move, Jane, because my internet's a bit unstable.
the stress that have for them, what they're actually. That's fine.
I'm going to move because my internet's not stable. So you carry on. Yeah, that's much better here, I think.
That's right.
So yeah, so what you're talking about is that young people will unconsciously, there's a herd dynamic, which is where, oh, we're all overwhelmed here, but this is something that the brain and the body will find a way to cope or not cope with the stress, and just shutting down various elements, whether it's chronic fatigue, whether it's pain, and that's sort of almost, well, it is a subconscious reaction to what's going on
Yeah, yeah,
around me.
absolutely.
And so then it falls out of the tree for anyone who understands yoga, that actually working in terms of like holistically, so socially, mind, body, within a familial structure, with all of the stress that's going on, and trying to sort of unwind that stress and to introduce the concept of parasympathetic nervous system,
Yeah,
would then hopefully have an impact on the FND.
yeah.
Yeah.
Absolutely. And I think the other thing that I noticed when I was doing the training is when we talk about the chakras, and the influence of postures and positions on those sort of
Yes,
energy,
psychophysiological areas of the body. Yes.
and 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 how often those, when we talk about what those chakras are responsible for, it was obvious. It became obvious to me that it was like a metaphor for what we see physically. So if you think of the throat chakra, in FND, someone might have trouble swallowing or speaking, or so if you were then working on that, you're actually getting into the parasympathetic and the sympathetic nervous system and helping them to regulate and to breathe, so I could see that, although it wasn't necessarily the terms I would use, that those kind of represented metaphorically what was going on in
Mm, mm.
bits of the body, and understanding that then helps you to choose positions and poses and things to do to help somebody.
I mean, I think this is really exciting for the yoga community to hear, that there's an acceptance, albeit in a different sort of maybe vocabulary, shall we say, but there's an acceptance of the importance of the holistic perspective of yoga and looking at movement and breathing and community as important elements to one very specific thing. Like you say, it might be the left knee or it might be the shoulder, but what, we look at the whole picture. What's going on in your life? What's the stress like at home? And this can unwind this so-called FND. I think that's really exciting. And how is it being accepted by parents and children, or do they not know that you're doing yoga? They just think this is sort of aspect of physiotherapy, which of course it is.
Yeah. Well, I haven't had anyone particularly object on any kind of ethical sort of
No.
grounds. We've
Yeah.
we've started to offer a regular yoga group, and we've found that we have variable levels of attendance, because it's a new thing,
Yeah.
and there are all sorts of reasons why people might opt in or opt out on various weeks, but we've had a regular sort of stream of young people through the group. I've used it, and I know my colleagues have used it in one-to-one sessions, and then it's a more sort of it's a slower burn in terms of introducing the fact that yes, they're exercises, but actually when you do this exercise, this is the impact on your body's physiology.
Yeah. Yeah.
So it's not just about that. It's about, how you do it and how you go away and practice it. And generally speaking, people, both young people and parents, have been very open because we can give them a really scientific explanation of what this is doing. It isn't
And
kind of,
what would that be? I think a lot of people would love to hear your explanation to a young person. Say you've got an 11-year-old boy in your room who's got some sort of FND and you'd like to explain to him why he might want to consider doing yoga. What would you
yeah.
say?
So it would depend on particular things he was presenting with. So if there was a degree of, yes, paralysis or the functional paralysis, what I would say is, what we want to do is to start getting normal activity and movement to happen in this area of your body. But if we do it in a kind of head-on manner, and your brain knows what we're doing, your conscious brain knows what we're doing, that's the bit that the FND is interrupting. So what we have to do is be a bit more sneaky,
Sneaky.
and kind of go the automatic route. So rather than doing something which is going to do a particular movement or a particular set of movements, what we're going to do is get you to do some things which will mean that your limb automatically responds to them without you having to think about it, without you having to sort of put that into practice. Because when we get your body to respond automatically, it will do it. And there are various tests that we can do with a young person to show
Yeah.
them what we mean
What you
about
mean by that? And
movement.
this is interesting, isn't it? Because one of my physiotherapists said to me that she had a lady who, 13, 14-year-old girl who was paralyzed, exactly that. And yet, in the middle of the night, she'd go up and have a wee.
Yeah, yeah. And being able to acknowledge that to
Yeah.
somebody and say that's actually completely normal, because in that place you're doing something automatically.
Yeah.
So your automatic brain, we know, so this is
Overrides.
we
Yeah.
know it's there, we know it's communicating with the rest of your
Yeah.
body. It's just the conscious bit. So, but if we can teach it something to do automatically, we can retrain your brain to hook into the automatic movements again.
Mm,
And we can start to take the emphasis off this particular thing
mm, mm, mm.
and further out. and not paying attention to this, not trying to do the movement, because that isn't going to work, but getting that automatic movement back is the way we're going to get this better.
Great, great, great. Yeah, I can see why that would work. Brilliant. So, how would you like to see, the future of the integration of yoga in physiotherapy and into young people's lives in general? I mean, how would you, if you had you had a magic wand and you could make it all happen, what would you like to see?
Um, I would I would love to see yoga available in schools as part of the curriculum, because I think it offers a real possibility through things like PE, the obvious kind of ways of going. We don't even have to go in any sneaky direction particularly.
Mm, mm.
It was part of something like a PE curriculum, and it was just something that people did and experienced, right from the word go. Then I think as soon as you start to have your own experience, that's the key to sort of being engaged with it.
And you realize it does something. You can feel
Yeah,
it in your body. You feel, oh, I sleep better. Oh, this pain seems to be less today because of it, or whatever. And that there's this sort of, like you say, the more holistic approach. So, okay, I have a pain in my knee, but I'm going to start moving like this, and now my knee doesn't hurt quite so much. And that seems almost magical. But the way you explain it, it's obviously we're just unwinding the nervous system, and we're making everything function smoothly again, and we're kind of coping with life a little bit better because we have these new coping mechanisms. Wonderful, Jane, wonderful. Well, I had a younger physiotherapist on my course recently, and she and I are going to write an article on FND, so we'd love to send it to you if you'd like
brilliant.
to edit it and give us. I know you're too busy to write it yourself, but you might like to help us
Yeah,
make
no,
it make.
that was super, because it is, I think, in terms of physical medicine, I think there's a huge amount of work to do in providing an evidence base, and I think we do need to start with things like single case studies and the incidental stories. But the ideal is then to sort of look very specifically at bigger groups of
Yes.
young people, and how yoga impacts their overall management of their
Yes.
conditions.
Is there anything in place there with Sheffield University or anything like that where you could be doing that?
So not specifically at the moment. We have an opportunity. So Sheffield University, Hallam, and the Children's Hospital have just set up a new sort of collaborative for research.
Oh, wonderful.
So that there are opportunities through that, and I think coming off the back of the APCP conference that you did your
Yeah.
recording for us, one of the questions I was asked in fielding the questions at the end was about that, was about, because a lot of the great work has been done with in normal teenagers. So
Yeah, no, absolutely. Yeah, yeah, absolutely.
but to work with say someone like the EDS Society, who fund a lot of research and look at hypermobile young people, there's loads of opportunities
We
there.
should definitely go down this route, Jane, and I would love to support you in that. And I need to also put you in touch with Joe Barker, who's the psychiatrist down in Southampton, who's
Yes,
doing the same for ED, eating
yes,
disorders down there.
absolutely.
And I think you two could have a very rich conversation. And I know she's brought Southampton Uni on board
Yes,
and she's got a very similar setup where she's got a small group for yoga from the people on the waiting list. So when they're waiting on the waiting list, they go there while they're waiting, sort of thing. And that yoga therapist also has people on one-to-one basis. But the idea is to capture the ones who are waiting and support them as they're waiting. Well, thank you so much for your time, Jane. I think it's a very exciting movement, and I can see it's a national movement. As I say, I've seen so many physios from all
yeah.
over the country now, which gives me great hope in supporting our young people in a more holistic and more kind of broader way that really will be a lifelong, support rather than a momentary fix your knee support, which I'm just obviously physiotherapists are really important, but I'm just thinking how wonderful to have that opportunity to go, this is a lifestyle that you could adopt to minimize this sort of thing,
Yeah.
which makes a lot of sense from an NHS and public health perspective as well, because we don't want to be firefighting issues that could be dealt with at home, So thank you so much for your time, Jane. Have a lovely rest of your day, and yeah, speak to you soon.
Yeah, pleasure.
Take care. Bye.
Bye.